To the Native American youth who want to become physicians, I have a message for you. It is possible. You can pursue medical school. My name is Brittany Begaye. I am a third-year medical student at the University of Arizona College of Medicine, Phoenix. I am Navajo. My family has lived in Arizona for generations. The work I do is for my community, my family, my future patients, and other Native students in medicine like me. I am proud to have been part of the collaboration between the Arizona Community Foundation and the University of Arizona College of Medicine, Phoenix. Thanks to this partnership, $306,000 in grant funding will support Native students on their journey as part of the Pathways Scholars Program.
We are so thankful for the grant from the Arizona Community Foundation. This is going to enable us to recruit 3 Native American students each year for the next 3 years into our cohort of 12, which is actually 25%. And in turn, these students will make a huge impact on Arizona and the patients that they take care of.
The Pathway Scholars Program was the right fit for me because the master's program helped me create a solid foundation to be successful in preparing for medical school. My classmates and I will graduate with a master's degree and an MD. From doctoring to simulation, we practice the skills and techniques needed to treat patients. Medical school is intense, but my classmates are like family. Not only do we train and study together, we also learn from and support each other. Being in a strong-knit cohort with strong support has been a great experience. My journey to become a physician began when I was a child growing up in Leupp, Arizona. I always aspired to be a physician, but was the first in my family and community to pursue a medical degree. I had first-hand encounters of the barriers Native Americans experience when receiving healthcare. For example, my grandmother has chronic medical conditions, and it is difficult for her to communicate appropriately with physicians that do not speak her native language. I also grew up in a rural community where the nearest hospital was close to an hour away. However, these experiences are not unique. For many Native peoples, barriers to medical care compromise our health and prosperity. In addition to language and cultural barriers, Native American communities face a real lack of qualified specialized care providers given the breadth and scope of Native issues facing these communities. This is why it's so important to have more Native physicians. I chose to complete the Certificate of Distinction in Rural Health alongside my medical degree because I intend to serve the Navajo Nation. My grandmother is the center of our family, and after my dad passed away, my mother and grandmother raised my siblings and me in this home. For 5 generations, my family has passed down the art of Navajo weaving. My grandmother taught my aunts, my mother, my sister, and me. Navajo weaving is a form of storytelling as well as art. It is an important part of our culture as well as my family's.
It's really important for students to be taught by faculty that are like them because role modeling is so important for any profession. When any population is being cared for by someone that looks like them, but again, had the same lived experiences, they can relate to that. I think it's the same for many cultures and many populations and many ethnicities, but even more so in the Native American culture, because it's quite a diverse culture in and of itself. There's many tribes and there's many nuances, and I think having somebody that is able to know, the exact remedies and recommendations for health is going to come best from somebody who has those lived experiences.
Native populations have among the highest prevalence of type 2 diabetes in the United States. I was fortunate to land a 2-year fellowship through the NIH, and I shadowed one of the few endocrinologists working within Indian Health Services.
College of Medicine Phoenix works to improve health for all Arizonans by training exceptional young physicians. Our unique Pathways Scholars educational program helps students from rural backgrounds, under-resourced environments, and communities prepare for the rigorous challenges of medical school by providing a year of personalized training and education. Students like Brittany Begaye inspire all of us with their determination and commitment and unique ability to serve Native American communities where the need for medical care is so great. Our heartfelt thanks to the Arizona Community Foundation, who provided needed support for our Pathways program by giving 9 scholarships for Native American students. Thank you.
When I look around my hometown, I see the need for better access to healthcare. I also see the beauty and the landscape and the warmth of the Navajo people. This is my culture, my tribe. They inspire the type of doctor I want to be.